Guys, welcome back to another video. So today's video we are talking about barrier method. We are almost done with family planning series or family planning videos. We talked about permanent family planning. We talked about hormonal or artificial family planning. We talked about natural family planning, and now we are at barrier method of family planning. Barrier method is not a method of family planning, but it is among the methods of family planning because you can use it as a method of family planning. So we have 4 types. We have the condoms, and we have the female and the male condoms. We have spermicides, where we have the tablet, the gels, the creams, and then we have the diaphragm, and then we have the vaginal sponge. I will be showing you in the pictures how they look like. So let's start with the condoms. Condoms prevent you from getting pregnant, and also it prevent you from getting STIs and HIVs. So the most important information that you should know about condoms, we have the female and the male condom. So the most important information that you should know about condom before you use the condom, let me show you. So I was saying these are the important information that you should know or you should have at the back of your mind before you use a condom or CD, whatever how you know it or how you call it. So the first thing you should know or you should do, you should check the expiry date. So what do I mean? I mean you should not use any expired condom because it can tear in the process. Yeah, it can tear in the process, and it won't prevent your partner from getting pregnant. So you have to check the expiry date. All the condoms, they usually have the expiry date, so you have to check that. Check if the sachet is completely sealed. What do I mean? It should not have any hole. If it has, you should not use it because it might be the infection maybe has already entered, or it might not be safe for you to use it. The next thing also you have to know, never add any lubricant on the condom while using it. Some people usually add Vaseline or they buy lubricant and they add on this condom when you are using it, but it is not advisable. Never add any lubricant when you are using the condoms. Another point, you must put it in erected penis. Yeah, you must put it in erected penis. And if you're using female condom, you always insert it, I think 30 minutes before the session. So this one you must put it in erected penis, and if you're using female condom, you have to insert it 30 minutes before the session. Another thing that you have to know about this condom, it is a single use. After using it, you throw it away. Yeah, you should not reuse it. What do I mean? You should not reuse it. That you've already ejaculated and then you want to go and pour the sperms and you start using it. You should not do that. It is for a single use. Whether you are using a female condom or male condom, it is for a single use. And the last point about something that you should know, or the very important information that you must have after using it, throw it away very well. Throw it away. You can burn it, you can put it on a pit latrine, but ensure you throw it away very well. So we are going to another type of barrier, because I said we have 4 types of barrier method. So let's look at the diaphragm. Yeah, let's look at diaphragm, and before giving you some information, I will show you how it looked like in the picture. So diaphragm is a barrier method, or it is a method of family planning, and it can fit in the cervix and prevent sperms from getting inside or from getting into the uterus. So it's look like this. It's look like this. This is the diaphragm. It is the diaphragm, and you can see the way it is round. It fits in the cervix. Yeah, it fits in the cervix, and now the sperms cannot pass through. Yeah, it is the sperms cannot pass through. And also something that I can say about the diaphragm, we have different sizes. So I think we don't have them in Kenya, but if you're in a hospital that you have the cervical cap or the diaphragm, kindly let me know, because I also want to see it. I've never seen it physically. So this method of family planning, or this barrier method, is what? This barrier method is very effective, and sometimes you can't use it if you have the uterine prolapse or recurrent cystitis, and also if you are allergic to rubber, you can't use it. Before you use it, or before the before the client use it, you must ensure that it fit well in the cervix. Yeah, and most of them contain spermicides, and spermicides, they are sperm killer. So that one will take us to the next step, the next barrier method, and that is the spermicide. So the spermicide, they are we have different types. We have the tablets, we have the gels, and we have the creams. And in these tablets or cream, they are sperm killer, or they contain some chemicals that destroy the sperm. So they kill the sperm, or they destroy the sperm. So when sperms enter into your vagina, it can't penetrate up to where it can fertilize the ovum, or or sometimes it can fail to move. So those are some of the how it works. So they are in form of cream, tablets, and gels. And now let us look at this vaginal sponge. Yes, the vaginal sponge. The vaginal sponge. Let me show you how it looked like. So before I show you, let me say that it is a synthetic sponge with spermicides, and we've said spermicides, they kill sperms or they destroy sperms. It is effective for up to 24 hours when you're using it, and those who are allergic to it cannot use it. So this is how vaginal sponge look like. This is how vaginal sponge look like, and you insert it into the vagina, and it releases the spermicides. And right now, I know you know what spermicide does. So those are some of the barrier methods. we have done with now barrier method. So in case you have any question concerning barrier method, guys, let me know. I will give you more information about it. So I would like to end it at that. Let's meet in the next video. Bye.